Hi everyone, good day. I will be one of your lecturer for Clinical Chemistry 2 lecture part. To formally introduce myself, you can simply call me Sir Von or Doc Von. I am also a graduate of this institution way back 2013. At the same year, I passed my board examination for medical technologies and I work as a full-time medical technologist at Digos Doctors Hospital Incorporated for almost 2 years. At the same time, I work as a part-time instructor at San Pedro College and for year 2014 and 2015. I am teaching Clinical Chemistry 2 laboratory part at that time. Then I decided to pursue medicine and I am a graduate of West Visayas State University College of Medicine in Iloilo City. Then I went back to Davao City and had my postgraduate internship at Southern Philippines Medical Center. Last year, I just recently passed my physician's licensure examination. Then I decided to go back teaching since teaching is really one of my passion. I decided to take a year off before I proceed to my residency training and I'm planning to take up pathology. I hope that despite our situation, we could still learn and have fun learning clinical chemistry. Shall we begin? For today, we will be discussing about your hypothalamus and your pituitary gland. I have given a copy of this lecture via your PDF handout, and within that handout are tips on how to study clinical chemistry 2. And this handout will only serve as a supplemental handout because our main handout will be your clinical chemistry book by your bishop. Principles, Technique, and Correlation 8th edition. And I hope that you will still read the book because that's gonna be our main handout. For our learning objectives, we will be defining the anatomic relationship between your pituitary and your hypothalamus. Then we will describe the function of each organs. Then we will understand the concept of your open loop negative feedback and relate this to the function of your virus hypothalamic pituitary endocrine target gland loops. We will also discuss the regulation of your hypothalamic and pituitary hormones. When we say regulation of these hormones, we are referring to how these hormones are being stimulated or being inhibited. Then we will describe the clinical features of the excess and deficiency state for their hypothalamic and pituitary hormones for the common disorders. Then we will relate now the physiology underlying the strategies used for screening and definitive testing for suspective disorder. In short, we will also tackle about how do we diagnose those disorders. Now we will continue with the anatomy of your hypothalamus. So basically, this is your brain. And this actually in your sagittal view. Pag sinabi nating sagittal view, you cut it here in the middle, slice, and then that's your mid-sagittal view. So this is your brain parenchyma, this one. Then this is letter C shape. Part is your corpus callosum, which basically connects your right and left hemisphere. Then this part here is your thalamus. And then below the thalamus is your hypothalamus. That's why it terms as hypothalamus. And below the hypothalamus is your pituitary gland. Now, in terms of the boundaries of your hypothalamus, it is superiorly bounded by your thalamus and inferiorly bounded by your pituitary. And it is posteriorly bounded by your brainstem, which comprise of your midbrain, pons, and your medulla. Your hypothalamus is basically seated in the third ventricle. What is remember that your ventricles of the brain, remember your anatomy, that your ventricles are basically where your CSF flows. So here, this area, it is where your lateral foramen of your lateral ventricle flows here to your third ventricle and then goes to your fourth ventricle. So in short, we know that your hypothalamus is within your third ventricle. Below your hypothalamus is your pituitary. So in short, your hypothalamus and pituitary are just somehow connected. In terms of the functions of your hypothalamus, it is basically on your maintenance of your homeostasis or your maintenance of your internal environment. Other Hormones includes your autonomic control, temperature regulation, regulation of food and water. That's why it is termed as your hunger system, hunger center, satiety center, and as well as your thirst center. It is also related to your emotions and behavior. And lastly, the most important part is your endocrine control. For the anatomy of your pituitary or your hypophysis, here, this is your hypothalamus again. Then we have your median eminence, which is connected to your infundibulum. And your infundibulum are what we term as your pituitary stalk. Your pituitary stalk connects your hypothalamus to your pituitary gland. This is your pituitary gland. Basing on this diagram, your pituitary gland sits on the sella turcica of your sphenoid bone. So basically, this is your sphenoid bone. It sits in your hypophyseal fossa. Your pituitary gland is divided into 3 lobes. We have your anterior pituitary, or what we term as your adenophysis. We have your intermediate lobe. Actually, some textbook, sorry, nagpumapiyok. Actually, some of your textbook that says that your intermediate lobe is actually part of your anterior pituitary gland. Then this is your posterior pituitary. So your anterior pituitary, which is your adenohypophysis, and your posterior pituitary, which is your neurohypophysis. I hope that's clear. Your anterior pituitary is termed as your true endocrine tissue. Why true? Because it can secrete its own hormone, while your posterior pituitary is your neuroendocrine tissue, because it cannot produce its own hormone, but rather its hormones comes from your hypothalamus. That's why it terms as your neuroendocrine or neuroendocrine neuroendocrine tissue. Let's continue. Now, Doc, what is the anatomic relationship between your hypothalamus and your pituitary gland? As what you can see here, your what do you call this one? Your pituitary stalk contains your vascular bundle. This one, vascular. A neurovascular bundle. It contains your neurovascular bundle. It contains your neurosecretory cells as well as your blood vessels. Doc, ano po yan, Doc? This one here are your neurosecretory cells. As what you can see in this diagram, your neurosecretory cells is connected to your posterior lobe of your pituitary gland. I repeat, your neurosecretory cells is connected to your posterior lobe of your pituitary gland. Doc, ano pong importance niyan, Doc? Remember, as I said, your posterior pituitary gland does not produce its own hormone because its hormone comes from your neurosecretory cells of your hypothalamus. Here, your neurosecretory cells will be the one that will form your hormones, specifically your antidiuretic hormone and your oxytocin. These two hormones are being synthesized in your hypothalamus. Here, in your neurosecretory cells, it passes through your infundibular stalk, then goes to your posterior lobe to be stored. In short, your posterior lobe does not synthesize or secrete hormones, but rather it is used only for storage of your hormones. Is that clear? Now, Doc, how about your blood vessel, Doc? For your blood vessels, as what you can see here, there is a big bulk of your blood vessels from your anterior pituitary, from your hypothalamus. In short, they are connected. 80 to 90% of your blood vessels of your anterior pituitary gland comes from your hypothalamus. Because this is what we term as now your hypothalamus, hypophyseal portal unit or portal blood vessel or portal system. This is what we term as your hypothalamic hypophyseal portal system. They are connected in terms of their blood supply. How about your posterior pituitary? As we can see here, your posterior pituitary has its own blood supply coming from its own organ or from its own pituitary gland. This is your inferior hypophyseal artery. Because this part here is your superior hypophyseal artery, which is also connected to your anterior pituitary and your hypothalamus. So, as a summary, basically, your posterior pituitary is just a continuation of your hypothalamus because its hormones are secreted or synthesized from your hypothalamus and just being stored by your posterior pituitary gland. Your anterior pituitary gland, 80-90% of its blood supply comes from your hypothalamus hypophyseal portal system. I hope that's clear. Now let's talk about the functional aspect of your hypothalamic hypophyseal unit, meaning what are the features or the function of these hypothalamic hypophyseal units. So meaning to say, how does these two hormones work as one? So there are three important features that we have to understand. We have your open loop negative feedback mechanism, we have your pulsatility, and we have your cyclicity. First, let's discuss about your open loop negative feedback mechanism. When we say open loop negative feedback mechanism, this is actually the mechanism that maintains the homeostasis or balance between our body. So ito yung klaseng mechanism na magme-maintain ng balanse sa ating katawan. Maintains the homeostasis of our body. So Doc, what do you mean by homeostasis or balance between our body through this negative feedback? So let's take this example. As we all know, your hypothalamus, later on we'll discuss the specific hormones being secreted by this organ. But for now, we will discuss first the different features of your hypophyseal unit, the function or the features. First, we know that your hypothalamus can secrete your thyrotropin releasing hormone. Your thyrotropin releasing hormone, this is why you're positive, will stimulate your pituitary. Then your pituitary will release your thyroid stimulating hormone. From the name itself, thyroid stimulating hormone, TSH. It will stimulate your thyroid gland to produce your thyroxine, which is your T4, or your T3, which is your triiodothyronine. So thyroid gland will produce now your thyroxine. So coming from your hypothalamus, because of your release your TRH, then stimulate your pituitary, then releasing your TSH, stimulating your thyroid to produce your T3 and T4. That's the normal mechanism of our body to produce your T3 and T4 using these three organs, your hypothalamus, pituitary, thyroid axis. That's the normal mechanism. Doc, ano po yung sinasabi mong negative feedback mechanism? Now, ganito yan. Now, your hypothalamus, when your body already, now for the thyroid part, when your body is able to produce now the enough amount of your T3 and T4, it will now signals your pituitary and your hypothalamus to stop, meaning I have already produced enough hormones and I do not need more hormones. So it will inhibit now your pituitary or your hypothalamus to secrete your TRH and TSH so that your thyroid hormone will not produce any more hormone, such as your thyroxine and your T3. In short, your thyroxine will serve as negative feedback towards your pituitary and your hypothalamus, meaning, kaya nga ito, negative symbol, that it will actually now inhibit your pituitary or hypothalamus. Doc, bakit ba natin kailangan pang inhibit ni thyroxine? Because if we are not going to inhibit this pituitary gland and your hypothalamus, then it will keep on producing your TRH and your TSH. Then what happens? Then we will have an increased level of your T3 and T4, and that's gonna be a complication, and that's gonna be a problem. Then we will have a disorder. Then we cannot maintain a homeostatic balance inside our body. That is why it is important to have a negative feedback mechanism, because through this negative feedback mechanism, we can regulate the hormones that is being produced by the body. We need a normal value of these hormones, because anything that will result into the decrease of this hormone or anything that will actually increase the level of hormones, then we will have a corresponding disorder. Then we do not want to have those disorder. This is a normal feedback, negative feedback mechanism. I hope that's clear. Doc, sinabi mo, Doc, open loop negative feedback mechanism. Meron po ba tayong positive feedback mechanism? Of course, we have a positive feedback mechanism. However, this positive feedback mechanism is not actually common. What is common in terms of regulating our hormones, regulating other functions of the body, is really through the negative feedback mechanisms. There are only few hormones that follows your open feedback mechanism. We will discuss in a while. Now, Doc, kanina, Doc, sabi mo, Doc, sige, balik tayo sa thyroid, guys, ha. Doc, sabi mo, Doc, kanina, pag meron na tayong maraming na-produce na thyroid, kanina, for example, your hypothalamus secretes your TRH to stimulate your pituitary so that your pituitary will release your TSH and your TSH will secrete your thyroid to produce your T3 and T4. Doc, paano po ba? Kanina, marami na tayong napuproduce na T3 and T4, napuproduce ng T3 and T4, and it will signals your pituitary to hypothalamus. Paano naman po, Doc, if kulang or our thyroid hormones is not enough? That's a very nice question. What if our thyroid has a low level? Thyroid hormone is low level, low T3 and T4. Then our body will compensate. Matalino ang ating body. It will send signals to your hypothalamus. Of course, if we have low levels of T3 and T4, mababa ang ating hormones natin sa T3 and T4, then there will be signals to your hypothalamus to release your TRH. Mababa ang ating TRH. Mababa ang ating T4 hypothalamus. So hypothalamus, you need to produce your TRH so that your TRH will stimulate your pituitary and pituitary will release your TSH to produce your thyroid. Doc, so in short, Doc, sa maliit na hormones kanina na T3 and T4, it can also stimulate your hypothalamus to release your TRH, pituitary, dadami na po ba ang ating thyroid hormone? Is that already a positive feedback mechanism? Do you agree? Is that already the positive feedback mechanism? Kasi kanina sinabi natin, negative feedback pag sobrang madami na. Pag sobrang madami na, T3 and T4, it will stimulate your hypothalamus and it will inhibit your hypothalamus to pituitary para itigil na ang pag-produce. Kanina naman, Doc, another example natin, Doc, is what if maliit na, T3 and T4, maliit ang value. So, stimulate na naman si hypothalamus to produce your TRH para paramihin si T3 and T4. Now, the question is that a positive feedback mechanism? Kasi, technically, it's the opposite. No. It is still a negative feedback mechanism. Doc, negative feedback mechanism? Yes, it is still a negative feedback mechanism because negative feedback mechanism is anything that you want to correct. T3 and T4, anything that you want to correct. For example, kanina sa example natin, mababa ang T3 and T4, paparamihin. That's a negative feedback mechanism. Marami ng T3 and T4, i-inhibit ni T3 and T4 yung hypothalamus and pituitary para konti na lang, para hindi na mag-produce ng thyroid hormone. That is still a negative feedback mechanism. So therefore, when we define open feedback mechanism, it is not the opposite of negative feedback mechanism. Open feedback mechanism is a type of mechanism that you are actually amplifying its own action. Doc, ano po bang ibig sabihin na you are amplifying its action? So later on, we will discuss about oxytocin and we will see what is that open feedback mechanism. But for now, I want you to know that there are only two important hormones that follows an open feedback mechanism. Almost all inside our body follows a negative feedback mechanism. But as far as I know, as far as what I'm being taught about during med school is that there are only two important events that follows an open feedback mechanism. Number one is your oxytocin. Your oxytocin is it produced by your posterior pituitary? No, it is not produced. It is actually stored in your posterior pituitary because it is being, just a review this is being synthesized by your hypothalamus. Your posterior pituitary gland, your oxytocin rather, will have an action towards your uterus because it is important for contraction of uterus during labor. Oxytocin is helpful during labor because it will help for the expulsion of your baby during birth. So in short, pag meron kang oxytocin, ito yung tutulong para mag-contract ang ating uterus. So Doc, paano siya nafa-follow ng open feedback mechanism? Ganito yan, guys. So now your oxytocin, oxytocin being secreted by your hypothalamus, then stored to your pituitary. When you are in labor, then your oxytocin will be released. Pupunta siya sa kanyang target, which is your uterus. Now in your uterus, when your oxytocin attaches to the target cells of your uterus, it causes contraction. This contraction will further stimulate the release of your oxytocin. It will send signals again to your hypothalamus to release more of oxytocin. In short, you are actually amplifying the action of oxytocin. From this hormone towards its target, you have already enough hormone here. Then it will go to your target tissue. Then this target tissue will further stimulate your hypothalamus to increase your pituitary, to increase your oxytocin. In short, you are amplifying its action. Pinaparami mo pa siya. May target tissue siya, yung target tissue niya, is-stimulate pa siya para magparami pa ng oxytocin. That is your positive feedback mechanism. I hope that's clear, ha? The difference between your negative and your positive feedback mechanism. But in general, majority of the hormones follow a negative feedback system. Review lang natin, ha? Let's just review. Negative feedback, ano nga yung negative feedback? Pwedeng, kung there is already enough hormones, it will stimulate other organs to inhibit its release. Or if there is not enough hormones, it will also still send signals to stimulate the production of certain hormones. Kasi nga, our goal in a negative feedback is to have a homeostatic balance. Normal values, normal system. Maintain the normal system of these hormones. I hope that's clear. While your positive feedback mechanism is not the opposite of your negative feedback system, but rather it is a system wherein you are amplifying the action of certain hormones. May hormone ka, may target siya. Ang target mong gland or organ will further stimulate to increase this hormone. Mas lalo mo pang paparamihin. I hope that's clear. If you have any question or still in doubt of my explanation, you can PM me anytime, okay? So I hope that's clear. Now let's proceed with your pulsatility. Do, ano po bang ibig sabihin ng pulsatility? Pulsatility is majority of or all of your anterior hormones actually follows a pulsatile secretion, pulsatile manner, pulsatile mechanism. Per se pulsatility, it is somehow burst-like release of your hormone. Parang isang labasan, burst-like release. It is not a type, burst-like, it is opposite to your constant release. More of, hindi siya constant release, but burst-like mechanism. I hope that's clear. Burst-like, hindi siya constantly produced by your system or by your body. Doc, how about cyclicity? When we say cyclicity, it follows your internal biologic clock. So, parang may sariling orasan ng ating katawan. It will know whether it is daytime or whether it is nighttime. Because certain hormones will be secreted depending on the time of the day. For example, ACTH and TSH. Your ACTH and TSH will have a nadir or a low value at around mga 11 p.m. to 3 a.m. But it will increase upon wake up around 6 a.m. to 9 a.m. It will peak, meaning akit ang kanyang value around 6 a.m. to 9 a.m. Doc, what is the importance of that? The importance of knowing the cyclicity or what we term as the diurnal rhythm of this hormone is for us to determine what would be the normal value of that hormone. For example, ACTH and TSH. Kumuha ka ng dugo ng gabi. Pero yung normal value mo nung normal value mo is a normal value which is high value, meaning you expect that hormone to be of that certain value. Will in fact you already know that the value of that hormone is actually low at that certain time. It is for us medical technologists to know that what would be the best timing to collect blood sample for these different hormones. Kasi nga, different timing, kukuha ka ng night or morning time, then there would probably be a difference of their normal values because we already know that some hormones follow a cyclicity type of secretion. I hope that's clear, ha? I hope that's clear. Now, let's continue. I guess we exhaust ourselves knowing your negative and your positive feedback. I hope that you understand now those topics. So let's proceed. Now, let's proceed now with your hypothalamic hormones. So what are the hormones being secreted by your hypothalamus? All of my tables here, the mga tables na nakalagay dito are basically comes from your your main handout, which is your Bishop Clinical Chemistry, and some of the tables of my lecture comes from Constanzo BRS Physiology 5th edition. So you have no need to read that BRS Constanzo BRS Physio book. What I want you to read is your Bishop Clinical Chemistry 8th edition because majority of my lecture comes from that textbook. And now let's proceed with your hypothalamic hormones. Your hypothalamic hormones are what we term as your hypophysiotropic hormones. It basically secretes 1, 2, 6 hormones. We have, kinount ko pa talaga, 1, 2, 3, 4, 5, 6. We have your thyrotropin releasing hormone, gonadotropin releasing hormone, corticotropin releasing hormone, growth hormone releasing hormone, somatostatin, and your dopamine. We have your TRH, GnRH, CRH, GHRH, somatostatin, and your dopamine. Now, from the name itself, no need to memorize everything, but from the name itself, anything na may mga releasing that comes from your hypothalamus or your hypophysiotropic hormone. From the name itself, ano bang function or action ito? Thyrotropin releasing hormone. It releases your TSH and your prolactin in your pituitary gland or anterior pituitary gland. I repeat, all of these hormones will have one target organ. What is the target organ? Main target organ, rather. The main target organ for this one is your pituitary gland because number 1, TRH releases your TSH and your prolactin in your pituitary gland. Gonadotropin releasing hormone will release your luteinizing hormone and your follicle stimulating hormone. Your corticotropin releasing hormone will release your ACTH. Your growth hormone releasing hormone will release your growth hormone. So basically very basic. As long as you understand that it's a releasing hormone, meaning it will release the hormones from your pituitary gland. These all hormones will release or stimulate your pituitary gland. Doc, paano po yung somatostatin and your dopamine? Your somatostatin, on the other hand, is actually inhibitory. It will inhibit the release of your growth hormone and your TSH in your pituitary gland. Additional effects is on your gut and your pancreatic function. Basta marinig niyo yung salitang somatostatin. Somatostatin is inhibitory in nature, meaning ang action niya lang is to inhibit. Wala siyang other function but only to inhibit. Kasi nga, it will inhibit your growth hormone and your TSH. And also, it will inhibit your pancreatic hormones. It can inhibit your insulin. It can inhibit your glucagon. It will also inhibit your gastric hormone. It will inhibit your gastrin and other hormones. In short, in general, wala, basta marinig yung salitang somatostatin. Somatostatin, inhibitory in nature. Somatostatin, inhibitory, ha? Basta marinig ang somatostatin, wag nang maisip, it is inhibitory in nature and it can also be secreted by your hypothalamus. Doc, paano po yung dopamine? Your dopamine, or what we term as your prolactin inhibitory factor, inhibits your prolactin release. Again, your dopamine or your prolactin inhibitory factor inhibits your prolactin release. That's very basic. So in short, your hypophysiotropic hormones has two functions. It's either stimulatory or it's either inhibitory towards your pituitary glands. It will either inhibit hormones from your pituitary glands, or it will either stimulate hormones from your pituitary glands. Either stimulate or inhibit. Inhibit, stimulate. Yan lang yung action niya. Basta alam natin, somatostatin is inhibitory in nature. Pero ang inihinibit niya is only your growth hormone and your TSH, while your dopamine is your prolactin. Your prolactin. I hope that's clear. Your dopamine, actually, we have so many, marami tayong function ng dopamine. It's not only a hormone, but also acts as a messenger. It also acts a neurotransmitter. Are you familiar with Parkinson's disorder? When you say Parkinson's disorder, it's a neurodegenerative disorder. Commonly sa mga aged individual, it can affect your movement. Kaya nga, meron sila tinatawag na cogwheel rigidity. They slowly, parang sobrang hina na kanilang action, because what is being affected by this disorder is your substantia nigra. Your substantia nigra is responsible for the release of your dopamine. So that's why, in terms of patients with Parkinson's disorder, we give your mga dopamine agonists as a management. I hope it's clear. Your dopamine has several functions, but for us, endocrine system tayo, so our main focus here is more of prolactin inhibitory factor as a factor that inhibits your prolactin. I hope that's clear. That's your hypophysiotropic hormones. So this comes from your Constanzo book, Physio book. So basically, these are the things that we already discussed. Your TRH, your CRH, your gonadotropin, your growth hormone, releasing hormone, your somatostatin, or what we term as your somatotropin, releasing inhibiting hormone, and your prolactin inhibiting factor. So basically, it's just the same. Medyo paulit-ulit lang ating handouts kasi the more na pinapaulit-ulit natin na dinidiscuss, the more that na-memorize at mas lalo nyo naintindihan. Okay? Now, let's proceed with your pituitary gland hormones. Your pituitary gland hormones, we have two glands, as what I've discussed. We have your anterior and your posterior pituitary gland. Anterior nga, ano nga yung anterior gland natin? Is the true endocrine tissue, while your posterior is your neuroendocrine tissue, because it's just basically a continuation from your hypothalamus. We have hormones being produced by your anterior, but your posterior, its hormones comes from your hypothalamus. Guys, paulit-ulit na lang talaga natin. Paulit-ulit. Sige ha, paulit-ulit para lalo natin naiintindihan at memorize. Okay, let's continue. So now, this is our overview of our pituitary gland hormones. So these are the hormones being produced by your pituitary gland. So this is in general ha. So this is the anterior hormones. We have your TSH, which will stimulate your thyroid gland, kasi ang term niya, tawag niya is thyroid stimulating hormone. We have your ACTH, your adrenocorticotropic hormone, which stimulates your adrenal gland. We have your FSH and LH, your follicle stimulating hormone, or your luteinizing hormone, which will have effects on your ovary and your testes. Now, we will have your growth hormone, basically for growth and development for your skeletal and for your bone. Now, your prolactin is for the breast, for milk secretion. Now, the two hormones being stored, I repeat, stored by your pituitary gland is your oxytocin and your antidiuretic hormone. Basically, antidiuretic hormone will have an effect to your kidney. Your oxytocin will have its effect to the breast and uterus. So we will discuss each of these hormones later. I hope it's clear, ha? So this is now the master list of hormones. So this comes from your physio book, Costanzo. Master glands of all hormones. From the name itself, we will know the TSH your thyroid stimulating will have effect to your thyroid to synthesize and secrete thyroid hormones. Your FSH, your FSH to stimulates your growth of ovarian follicles, promotes sperm maturation. Your luteinizing hormone for ovulation, formation of corpus luteum, stimulates synthesis and secretion of testes. I hope these are actually you can just basically read this one, but actually we are going to discuss all of these hormones. This is just an overview of all the pituitary gland hormones. Now let's proceed with our anterior pituitary gland.